I'd like to talk about fungal nail infections today, and the chances are if you've got a fungal nail infection, you're the only one that knows about it because you're hiding it in your shoe, you're painting it with copious amounts of nail polish. But fungal nail infections, when they're exposed, you'll notice that they're very often yellow, crumbly, thick, discoloured, and in fact there might even be some discoloration around the nail. It might be a bit red, or there could be some evidence of athlete's foot on the rest of the foot. Fungal nail infections are caused by bugs that live on your skin naturally, and they're opportunistic, and they're taking advantage of a situation which gives them the opportunity to infect the nail itself. So that might be that you've been unwell, it might be that you're undergoing a course of chemotherapy, it might be that you've had a bash on your nail or an ingrown toenail, or you might have been swimming for a period of time and the foot's been wet and sweaty. The spores on the fungal nail can transfer to other nails, so if you've got one nail infection, you've probably got it on others, and that's the reason that you'll have that redness around the skin. With your treatment options for nail infections, you've got roughly four treatment options. The first option is to paint a nail paint on the nail, an antifungal paint, and this will take about a year and done every day, probably twice a day. It's pretty safe, but it's also quite time and labour intensive, and you don't really want to be missing much of those treatments, otherwise you reinfect the site. The other option is to have a tablet taken by your GP, prescribed by your GP and taken, and it will be taken every day for about 6 months. Downsides being side effects and the fact that it's a systemic drug and will treat everywhere on your body, including your stomach flora. The third option is to surgically remove the nail, and that'll be performed by the podiatrist, and the hope there is that you'll end up with a clean, fresh nail growing out. And the fourth option, which I'm really wanting to chat to you today about, is the use of laser therapy, and these split broadly into two categories: hot and cold laser. The hot is the more old-fashioned treatment approach. It involves heating the bug up and causing it to die. But the downsides being that it's painful, it's usually handheld operated, and therefore open to human error. So cold laser therapy is a new offering. It's a treatment option that has only really become available in the last 5 years, and it's been used in the UK and Australia quite successfully. And as a clinic, I'm proud to say that we're the first in New Zealand to offer it. Cold laser uses two lasers which work at different spectrums of light, and the one laser destroys the cell wall, and the other one stimulates blood flow to the area. Its treatment approach is quite straightforward. The podiatrist identifies the pathogen or the issue, confirms the diagnosis. So that can be done by a simple lab test done at the back of the podiatry room. It takes about 5 minutes. The nail's then prepared once it's confirmed to be fungal, prepared by thinning it out, and the application of the laser occurs, and it's a 12-minute course per foot, and that treatment is once a week for 4 weeks. And at the end of that 4 weeks, we then take some photography, initially as well, of course, to compare that progress. But every month, for about 3 or 4 months, we take photos to monitor the progress of that nail infection. To summarise, cold laser is safe, it's pain-free, and it's highly effective, and it's definitely the best option that we have available. If you are wanting an appointment or wanting a consultation with a podiatrist, just give us a call and let us help you.